Hi everyone. So one of the most common questions also get asked is what are the complications of a tummy tuck? Well, like any of the surgical procedures, it can have different complications. Now these are infection, it is bleeding, bad scarring, over liposuction can cause contour abnormalities, or if the surgeon is not careful or there were previous surgeries done, then the blood supply to the skin flap is compromised and you can have an area of dead skin right in the suprapubic area. So infection and bleeding are relatively low, but every surgical procedure carries its own risk. So about 2 to 3% or 5% chance of infection and bleeding can happen. Now, with the bleeding is concerned, most of the patients at the end of the surgery has no bleeding, but afterwards, as they're recovering and they're waking up, the blood pressure tends to go up, and small blood vessels that were not bleeding, they open up and they can start bleeding. So scarring. Everyone scars differently. If the same scar is made in 10 different people by the same surgeon and closed in the same way, it will still lead to different scar formation. Third, contour irregularities. If the liposuction is performed very superficially, then it can cause contour irregularities, which is hard to fix. And the most dreaded complication is skin loss in the lower abdomen, and that happens if the surgeon is not mindful of the blood supply of the abdominal skin. And most of the board certified plastic surgeons are very well versed in the anatomy and the blood supply of the abdomen, and they know how much liposuction to do, which areas to dissect, so they can avoid that complication. I think it is very important for the patients to do their due diligence and research and always seek advice from an experienced, well trained plastic and reconstructive surgeon.